I'll go to Dan and Joliet. You're on First Light.
Hey, good morning, Evan.
Hi.
So I have United Healthcare, and that's through my workplace. But I have, I believe, at least $3,000 deductible, a $50 copay per visit for any doctor, and I only make like $13.50 an hour. I'm in the tax bracket what you would consider poor.
Sure.
So I can barely afford any treatment, and even if I can afford treatments and medication, I can't really afford the medication that I want because the state of Illinois is unconstitutionally violating our rights and not allowing us for certain medical marijuana for certain conditions. It's only legal for like 8 conditions, even though the federal government has patents on it as being an antioxidant, a neuroprotectant, and more. So even though I do have insurance, I can't even get the proper medication that I want because, I currently, I have a separated shoulder or something, so I need pain relievers, but I don't want to do acetaminophen, pills because that kills your liver, and I don't want to do, other pills. So my solution currently is taking kratom, which is a natural supplement, but I should be able to take marijuana for that, ailment. Why they're not allowing me to, that's a violation of my rights.
Okay, so you're talking about marijuana, but the other thing that you brought up is how much you make and that you're working. I mean, everybody so many people, not everybody. I don't want to get into this. Everybody does this. Everybody does that. So many people talk about how all these people on welfare are collecting welfare and they want Obamacare and this and that and the other thing. I know lots of people who are working at big box stores and other places who are on food stamps because the only job they could find ties them up 8 to 10 hours a day, and they're making $10, $12 an hour. And so it's not necessarily a lack of a will to work or even ability to work that is holding them back.
Oh, no. I've seen people quit my workplace, and it's like, wow, people that are complaining there aren't jobs. That's just straight up not true. There are jobs. But like you're saying, apparently some people just don't want to work. I have no problem working. Even though I'm slightly injured, I still come into work every day. But like you're saying, a lot of us, we just don't quite make enough money at our jobs to afford the health coverage, even though we have insurance through our employers.
Yeah. Hey, thank you for your call.